The video started though. Hello everyone, welcome back to my YouTube channel. In case you're meeting me for the very first time, I remain your adorable midwife, your #1 most essential healthcare provider that brings healthcare services and healthcare solutions to the comfort of where you are. Guys, guess what we're going to be talking about today? Before you guess, let me just give you a small hint. This topic is for mothers and their female children, their upcoming female children. You already know. I'm doing a hint, already know. So today's topic, we'll be talking about menstruation part 1. Menstruation, menstrual cycle, everything you need to know about menstruation. We are starting a series. And today is the part 1, so I urge you to stay with me to the end of the video because you'll be learning a whole lot of things. In fact, things you think you know and the ones you do not know, I'm going to revisit them and I'm going to tell you again, really, to be able to have adequate knowledge on how to take care of yourself and your child during menstruation. You know, as usual, I like defining, so I'll start by defining what menstruation is. Menstruation can be defined as the monthly flow of blood from the womb through the vagina. I'll take it again. Menstruation can be defined as the monthly flow of blood from the womb, where we call the uterus in the medical terms, right? From the uterus through the vagina and then outside. For the sake of our class today, I'll define some terms that I'll be using, which there is no other English word that can replace it, you know. But these terms I'm going to define are things you're already familiar with. I just want to bring back our knowledge to it. So number 1 is that the womb is divided into 3 layers. Number 1 is the perimetrium, the second is the myometrium, and the last is the endometrium. Another thing I want us to know about is that ovulation happens before menstruation. Ovulation is simply the release of the egg, you know, during the release of the egg from the ovaries so that it will get ready to be fertilized. Then when it doesn't get fertilized, it disintegrates and comes out as menstruation. Menstruation cycle or the flow of blood should last between 3 to 5 days. 3 on the least and then 5 on the max. If you have a blood flow that is more than 5 days, please go and see your healthcare provider. It could be normal, don't quote me wrong, because you could follow the trend of your mom or your mom's sister or whatever. But if it's not like that in your family and the first person to come up with this kind of condition where you have a flow that lasts more than 5 days, please go and see your healthcare provider. So 5 on the max, right, and 3 at the least. Then another knowledge I'd like us to know about is that the average menstrual cycle is between 28 to 30 days. 28 on the least and 30 days on the max. Now, menstrual cycle, they are harmonious and regular cyclic changes that happen from the beginning of a particular menstrual flow to the beginning of another one. Another one is the menarche. Menarche is a medical term to define the first menstruation a female will ever experience. That first blood flow. You know, I used to be, guys, a lot of gist in this topic. Just stay with me to the end. So, menarche, like I said, is the first menstruation a female child will ever have or have ever experienced. Then the next term is menopause. Menopause is the last menstruation a female will ever experience. Yes, with these things being understood, I want to dive into the topic major. So for the purpose of today's class, I'll be focusing on menarche. Menarche, the first menstruation a female will ever have. I'm going to explain or describe the woman's body, the woman's reproductive system, but I'm going to pick the ones that are responsible or important to this class today. Number 1 is the uterus. The uterus is the body of the womb. The uterus is the place where babies get embedded, okay? Then we talk about the ovaries. So the ovary is the one that houses the eggs that gets released during ovulation, okay? Then we're going to talk about the cervix. The cervix is the neck of the womb, or the neck of the womb, or the last part in the womb or the uterus, okay, that leads to the vagina. Then we're going to talk about the vagina. The vagina is simply the tube that the blood flows out through. When it comes through the womb, it goes through the cervix and then flows through the vagina. And then another part I'd like us to know about is the vulva. This vulva now is what people call vagina. Please, it's not vagina, it's called vulva. The vulva is the outer part of the woman's reproductive system. So we have the mons pubis, which is the part where hair grows, okay? That part that divides your lower abdomen from your reproductive parts is called the mons pubis. We have the mons pubis, we have the labia majora. The labia majora is that two leaves that is placed side by side on the vulva. After the labia majora, the next you get to see is the labia minora. That's when you kind of part the labia majora open. You see the labia minora is just small. It's also two fold of leaves at each side. Then we'll talk about the vagina orifice. That is the place leading into the vagina. So from the vagina back to the cervix and then back to the uterus. Okay. Then we're also going to talk about the anus. I'm going to talk about the anus because I'll teach you how to take care of yourself during menstruation. So the anus is of important factor to us today. So the anus is that place where poo comes out from. That's the physics. When you go to the toilet to do the number 2. That place that the number 2 comes out from. It's called the anus. So with this being said, I will be concentrating on menarche, because we already know normal menstruation, the continuous menarche that happens, and then we already know about menopause, the one that happens to our elderly mothers, as they're aging, menstruation starts declining and all of those, and then eventually stops. Today, talking about menarche, and I earlier defined menarche to be the first menstruation any female will ever experience. In menarche, what are the signs and symptoms? Your daughter might not be able to note these things, but you as a mother, you should be able to know these things and then put your daughter through. Because I know most of us did not even get this informal education from our parents. Most of us didn't get it. So you don't have to let your daughter or allow your daughter pass through the same stress. Once you've noticed any of the signs and symptoms I'm going to be talking about, please call your daughter to order, talk to her, educate her about menstruation, and then make her expect this menstruation so that during the time when it comes, she knows what to do about it, whether you're close to her or not. Menarche, which is the first time a female experiences menstrual flow, is likely to happen at the same time her mother's own commenced. As in, if you're for your child, her menstruation is likely to happen at the same time yours started as her mother. So if you started menstruating at the age of 11, there's a possibility that your female children will start menstruating at the age of 11. So what are the signs and symptoms? Number 1 is breast development. Breast development, for the obvious thing, it starts from the nipple. For some other people, it starts from the body of the breast. Note actually that breast development starts from the axillary tail. That's for those in the medical line. But for those of us that are not in the medical line, for obvious thing, okay, it starts on the body of the breast or on the nipple. And then it has to happen 2 to 2.5 years before menarche. So if you notice your daughter starts to come up with breast growth, just know that in no distant time she will start menstruating. Another one is pubic hair. That's another sign that will happen to show that this lady or this young girl will start menstruating anytime soon. Is hair on her armpit and hair on the pubic region. So people call that vagina. If I catch you calling it vagina, it's not vagina, it's vulva. And to be specific, on the mons pubis, that's the part that divides the abdomen from the lower or external genitalia or the external reproductive part of the woman. The mons pubis, you see hair starts to grow at that part. In fact, the females at that point start wanting to bath in the bathroom. Okay. Another sign I want us to note is growth sprouts. Okay, your daughter just tall. She just, from the dwarf that she was, she just grows very tall, and you're like, Meso, it doesn't gonna go. As per, so you're becoming tall. No, Mesoma is not just getting tall. It's a sign of menstruation. Just look out very soon. she'll start menstruating. So don't just take it to be any kind of thing. Okay, I know this must have happened to you. It's even happening to your daughter presently. Start gathering her, start planning or orchestrating ways where you can, call her to yourself and give her health talk, particularly on menstruation. Then another sign and symptom is mood swing and tiredness. You see that your agile daughter that wants to always sweep every morning. In fact, when you're washing clothes, she wants to come and put her inside the room. Mommy, let me help you and wash. And whenever you're cooking, she will come. Mommy, let me help you and cut ugu. Or whenever you want to fold clothes, Mommy, let me help you and fold clothes. I can fold it. She's gradually passing that stage of being a child. She's now being all tired. In fact, you have to call her. Mesoma, come and sweep this your room. Won't you sweep today? And she say, Mommy, I'm tired. Please. That tiredness is not any kind of tiredness. It is menstrual, menarche tiredness. So anytime you notice your daughter is always easily getting tired, watch out. Very soon she'll start menstruating. And then for the mood swing, you just find out that she doesn't just want to eat any kind of food. Normally, if you just cook and give them, they will eat beans or eba or whatever they will eat. But this time she's very selective. And if you don't give her what she needs, she gets angry. Then you guys will just be gisting and they'll be talking, and all of a sudden she's just all not interested anymore. They're asking her, Miss, so what is it? She says, I'm just tired. I just want to go and rest. I just want to go and sleep. Please. She's not just tired. She's not just having a mood swing. Her body is changing and she's not just understanding what is happening to her. Her body is changing and she's trying to figure out what exactly this is. She's probably not happy about it, but she can't help it. So at this point is not when you should start, you're becoming too lazy. I don't know what is wrong with you. Call her closer and let her know that these signs and symptoms is this thing she's experiencing is a sign and symptom for menarche, and then explain to her what menarche is, and then make her expect it. How do you make her expect it? Get menstrual pad and keep for her, or cut the pieces or wrapper. For those of us that don't have money to buy menstrual pad, you can buy a wrapper, okay, or your wrapper, wash it very clean, keep it for her. Let her know that once you see blood, this is what you should do, and don't make there are ways you should teach her. Don't just tell her once you see blood, because my little girl will just be thinking, blood, poo, 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 poo. The blood will just be pouring out. No, let her know that it's going to be just drop or just a little flow, just tiny something that will just feel, not necessarily feel the pants, okay, but that will just stain her pants. Yes, let's use that word stain, so that she will not go out of line thinking that something is about to be wrong with her.